been almost 3 weeks since funding expired for the Children's Health Insurance Program, with no action in the foreseeable future. I'm Bryn McBride of ABC for Health. We're talking about CHIP here, the Children's Health Insurance Program. It's a program that helps give lower and moderate income children and some parents health insurance through the Medicaid type program. It covers over 9 million children nationwide, and funding expired for this program on September 30th. Now, legislation has been written in both the House and Senate to reauthorize the CHIP program, but no action has been taken. No action is expected in the foreseeable future, as both the House and Senate were on back-to-back recesses. We thought we'd take the opportunity while they're on break to let you know what those bills look like. Now, the Senate has a bill that they call the KIDS Act, the Keeping Kids Insurance Dependable and Secure Act. The House came up with a longer title, mostly just to spell out the acronym Healthy Kids, which they have titled the Helping Ensure Access for Little Ones, Toddlers, and Hopeful Youths by Helping Insurance Delivery Stable. Now, it's a complicated mouthful, but both of them are getting at the idea that they want to continue the Children's Health Insurance Program eligibility up to 300% of the federal poverty level. Now, with the 6% disregard in Wisconsin, eligibility for Badger Care Plus, which is a merger of the Medicaid and CHIP program, means that kids up to 306% of the federal poverty level are eligible. They want to both keep express lane eligibility, which we call express enrollment here in Wisconsin, as an option. They want to keep maintenance of effort requirements, which is a big win. Now, these are the requirements that prohibit states from freezing program enrollment, especially in times of economic downturn. We have learned from history that getting rid of maintenance of effort requirements is traumatic. We can point to the state of Arizona for examples in the past where economic downturn meant a freezing of their CHIP program and therefore losing several children off the program at a time when they needed it most. Both the House and the Senate version as well start eliminating the 23% enhanced federal funding that came out of the Affordable Care Act, but they eliminated it over time. It has stepped down through the year 2021 or 2022, depending on which version of the bill you are looking at. Now, we're going to spend most of the rest of our time today looking at the House version of the bill because that Healthy Kids Act is a little bit more extensive than the Senate's Kids Act. It goes on to do a couple other things. Some of them are quite curious, and others you can see some of the politics at play by some of the drafters of the legislation. The House, in their version, adds an additional provision to address ongoing CHIP budget support, which is potentially a good thing, looking a little bit longer term. It addresses financial incentives, expanded authority for states to pursue payment for CHIP services from third parties that are liable for payment. And it also authorizes states to intercept lottery winnings to recover Medicaid overpayment. So something that doesn't happen that frequently, but for some politicians, it was really important that they include it in this version of the CHIP authorization bill. Now, the House also does a couple more things. It actually does a lot more things, but we're going to keep it short for purposes of today's discussion. They're going to require states to include gambling winnings or other lump sums as countable income. So you can see the same person that was worried about the lottery winnings was also worried about how to count gambling income and other lump sums. Now, traditionally, lump sums are counted as assets, not necessarily income for a lot of Medicaid programs. Here, they want it to be treated as income. Now, they also want to eliminate Medicare Part B and D premium subsidies for seniors with higher incomes. So unrelated to kids coverage entirely is this addition on seniors with high incomes that they want to sneak in here. They also want to delay cuts in uncompensated care reimbursement from feds to safety net hospitals. Now, here are a couple other things. Promote the development of state-run premium-based insurance program for children who are not financially eligible for CHIP. So that's a little outside the scope of the CHIP program, but they want to start looking at state-run premium-based insurance programs for children. They also want to allow states to include children enrolled in CHIP lookalike programs, which pretty much create insurance risk pools, the same risk pools as CHIP enrollees are in, so pooling your children together into different risk pools. Now, the Affordable Care Act idea was to try to make sure that you could start adding some young invincible, some of those healthy younger people into the marketplace to bring down costs because children and young adults are a little bit healthier and a little bit cheaper to insure than older folks. So what this bill does is try to clump some children not just into the CHIP programs, but also into some CHIP lookalike programs to start spreading some of that risk and bringing the cost down as well. Here's another part of the bill that's very distinct from the Senate version in that it starts adding more money for the territory of Puerto Rico. After the devastation of Hurricane Maria, they have a specific carve-out that includes additional Medicaid money for the territory of Puerto Rico. It also includes financial incentives and program administration requirements to reduce Medicaid program fraud in Puerto Rico at the same time. Now, there is a sense of urgency, not just for the territory of Puerto Rico as it's recovering from the hurricane, but because time is of the essence for how much money states have left. It is guaranteed that about 4 states will be completely out of CHIP money by the end of the calendar year. The state of Minnesota is in that boat. The state of Wisconsin is looking more like some of the other 20-some states that said they will be out of CHIP money by spring of 2018. The Senate and the House have to reconcile their versions. As you can see, the House version has several more elements to it than the Senate version at this point. They have to reconcile those and they have to get them to the president for signature. It's not clear how fast they can do that. Many question whether they can do that by the end of the calendar year, which puts states like Minnesota in quite the crunch. You can read that Senate Kids Act and the House's Healthy Kids Act. You can compare for yourself and you can join the conversation with us. Send us your healthcare story, your questions, or send us an email with your comments. And you can find us at healthwatchwisconsin.org.